Welcome to my podcast. Today I'm going to talk about another subject. It's a big one. You will face it on most of the cases and most of the situations. So it's basically about big names, which is pain. So after you introduce yourself to the patient and double check the patient name and date of birth, you will ask the patient, "How can I help you today?" So the patient will say, "I'm in pain, doctor. Can you help me?" So you will try to understand. Exactly about the pain and ask the patient, how long you have this pain, and you will ask, tell me more about it. So the patient will tell you, for instance, it started blah 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 since few days, and it's just like that. So you'll ask. We know that pain it's a very unpleasant situation, and it's really annoying, and especially when the patient is in too much pain. And myself, I have this pain, and I can understand how it feels and how it can put you off. From a lot of things. So basically, we'll ask the patient, can you point with your finger where about the pain? So you need to know where is the exact spot of the pain, and then ask the patient if your patient can describe the pain, what characteristic of the pain, how it feels. So let the patient explain in their own words how the pain is characterized, and also ask the patient on a scale from 1 to 10, where would you rate yourself currently with the pain? So this will give us a hint about the intensity of the pain, where 1 is no pain, and 10 is extreme pain, that's intolerable, and the patient might be in a really devastated situation. So then I need to ask about the pain, if it was gradual or if it's sudden. So most of the situation, we know that pain can be divided into acute, subacute, and chronic. So chronic, anything beyond 12 weeks, it's chronic. So most of the cases of sudden is acute, and it's in most situations curable. However, those pains which comes and goes and stay for quite a long time, they will fall under the chronicity state. You'll ask the patient if there is any history, of course, of a trauma that can be linked to the pain, and ask the patient if they have an air in their own mind and in their own thoughts, of they have an idea what might be the cause for their pain. You'll ask them if the pain is continuous or intermittent, or if it's come and goes. You will ask also if there is any associated symptom at all, like patient they might feel nauseating, they might collapse, pass out. You will ask if there is anything that could ease the pain or make it worse. If the patient feel better at the start of the day, and if it's worse by the end of the day. So all of that you need to ask, just as general questions for any pain. We know any part of the body can be affected with pain, but I'm talking just generally speaking how to approach pain as a symptom in any case you might come across. And then, of course, you will examine the patient according to the situation and according to the differential that you put in your mind, and then agreed with the patient about the management plan, and if there is any investigation that you need to send off, or just checking the patient. So there are certain ways that you need to bring the patient attention to about pain or minimizing it. So basically, this will apply in those cases of chronicity. So you will ask the patient, they need to keep active. They can do certain gentle exercise or light one, like brisk walking, keep moving. They don't need to sit still or just take painkiller and think that the pain will go away. So they need just to keep moving, brisk walking, for instance, gardening. Certain patients that like gardening, so can do that. Some they like dancing, for instance, or swimming, or doing certain activity. All of that can ease the pain by blocking the pain signal in the brain. So you need to ask the patient, you need to keep active in order not for the muscle to be stiffened, or the ligament or the joint around whatever part affected in the body. This will keep muscle moving and active. If the patient, for instance, is worried about anything, or maybe feels that this might cause any damage or any issue, You will just direct them accordingly and explain the situation. Also, it has been known that deep breathing can ease the pain. So, tell the patient you need to concentrate in your breathing. So, you need to try to take slow, long ones, and you can count from 1 to 6 or 1 to 10 while you are inhaling and exhaling. So, this will help with the pain intensity gradually, and you need to do this on a regular basis and try to make it like a habit in order to notice some differences. And this will, of course, help to prevent the muscle spasm and tension or anxiety, and will make the situation a little bit better by relaxing. Also, you can hand the patient certain leaflet about pain or direct them to certain website or give them certain information, patient information leaflet, which could help, basically about the sort of pain they are experiencing. So basically, to any part of the body, there is always a certain booklet can be provided, and according to the patient presenting symptom, or the differential that you have in your mind, you can hand them that booklet or that leaflet to read about. Also, there's in certain situation, you need to shift your attention from the pain. So you can distract your mind by doing certain stuff that you like or enjoy, which can keep you in the mood. So encourage the patient to do certain hobbies that they feel that they are good at or they like. Encourage them to do that. Certain patients, they find photography, for instance, appealing to them. Certain people, they find looking at nature, group meeting, chit chat, drawing, for instance. Some people, they find it therapeutic. The whole idea is about distracting the mind and not concentrating about the pain, because the mind can do wonder when you try to distract it. For certain ladies, they might get interested more in sewing, knitting, doing stuff manually. So there's a lot of creative work they can do, which can help the momentum and free the mind from distracting it. In certain situation, when the patient feel too much pain, tired, depressed from this pain, and they feel they can't cope anymore, and they feel that they can't move on with their life, or it's limiting their activity, and they feel the need to talk to someone. So counseling or talking therapy can be arranged, which can help the patient to talk about their emotion, their feeling about the pain and how they make them feel. Also, there are certain groups which can gather together and talk about their own experience about pain. So you could tell the patient about certain groups which dealing with pain. Like, for instance, there's a certain group called Pain Concern, so other groups called Action on Pain. So there is different ways the patient can engage with other members and people who can talk about what they are doing in those kind of situation. Also, it's been known that sleep cure for the pain. So you have to emphasize that sleep is very good for the pain, for the body will hibernate, will feel more relaxed, and try to make it like a habit that you need to stick at a normal sleep routine. Because if you have sleep deprivation or insomnia, this could make the situation worse. and it might not help with the pain. So in order to feel more relaxed, more refreshed, you have to stick to a normal sleep pattern, which could help, of course, with the pain, and make it a little bit, easing it a little bit, and make it a little bit for the patient to cope with certain with those kind of situation. Also, it's advised that to keep in touch and talk with your loved ones, so the close network to you, like family, friends. It's good to talk with them and try to see them for short visit and invite them, or group gathering for a tea or chat. This will make things more better in terms of the pain. It's advisable as well, as part of the breathing, as I say, to relax in order to relieve the pain. So try to practice certain relaxation method like the breathing I just mentioned, long, slow, deep breathing when counting, and also certain meditation can help. So it's basically like you just see yourself in a nice situation that you create in your own mind, and try to relax. This will distract your mind from the situation and make it more pleasant for you. And also, you can join up, ask the patient, you can join up for self management of the pain. So there is certain courses whereby the patient can join in to understand about the pain and try to self resolve and self mitigate the pain, so they can develop certain new skills in order to help manage relieving the pain and beat it up. So that's in general some ways whereby you can advise or apply on you personally whenever you have this pain, because no one is pain free anyway, and just to help because it has different ways and different approaches where it can do wonders to the body. Thank you.